Choosing ABC 15 News at 6:30, I'm Katie Ramble.
And I'm Steve Irvin. They were ground zero for the coronavirus pandemic. Since January of 2020, more than 1,200 residents of nursing homes have died from COVID-19, according to AARP. On top of that, facilities continue to report massive staffing shortages. More than 20% of nursing homes in Arizona say they don't have enough qualified workers to care for our most vulnerable friends and family.
This week, Governor Ducey announcing he is disbanding the state board that licenses and regulates who manages and operates long-term care facilities. He cited an Arizona Republic investigation. The governor saying the board failed when it granted a license to a convicted felon, failed to investigate complaints in a timely manner, and failed to provide accurate information to the public.
Now, Governor Ducey wants the state health department to take over regulating and licensing these facilities. ABC 15's Mark Phillips is asking tonight, will that make a difference?
AARP State Director Dana Marie Kennedy doesn't have a problem with getting rid of the oversight board. It's what comes next.
I think it's a step in the right direction. I don't know if he's actually able to do that. There are some federal guidelines that must be adhered to.
In his veto of the bill, which would have extended the board through 2029, Governor Ducey said he will work with the legislature to transfer licensing and regulating duties to the Department of Health Services. In 2019, the Auditor General reported DHS had its own problems investigating, prioritizing, and resolving complaints at long-term care facilities. According to the report, the uninvestigated complaints included allegations of abuse, neglect, and unsanitary living conditions.
And we think an audit needs to happen, especially in light of what has happened in our long-term care facilities.
AARP has asked the governor to include funding for an audit in the upcoming budget. It also wants to be part of any state oversight of assisted living facilities. The veto means the board will be dissolved as of July 1st, which the Arizona Healthcare Association says is not much time, because any alternative the governor chooses must meet federal approval.
We already have a staffing crisis in this state in nursing homes. We don't need another delay of 3 or 4 months or 6 months or whatever the case might be on trying to get more nursing home administrators licensed. That can't happen.
A spokesman for the governor's office says it won't. Mark Phillips, ABC 15, Arizona.
ABC 15 going in-depth into the challenges facing these facilities and the people who live there. There are 160 licensed long-term care facilities here in Arizona. According to the Kaiser Family Foundation, more than 10,000 Arizonans live in these facilities in 2019. 57% of Arizona's nursing home residents have their fees paid through Medicaid. And because Medicaid pays out benefits at half the rate of other providers, it means those facilities tend to be underfunded and struggle to hire high-quality employees at competitive rates. 21% of nursing homes in Arizona were considered to have serious deficiencies in 2019. And that means problems that could or already have resulted in injury, illness, or death of a resident. Now, the problems facing nursing homes here in Arizona and really across the country are complicated, and the solutions aren't simple either. But there is one thing you can do right now to find out if a facility caring for your loved ones has had problems in the past. It's the Arizona Department of Health Services. They've got a searchable database for you. It's called AZ Care Check. It's going to list all the long-term care facilities here in Arizona, and right there you can read about complaints filed against individual facilities and their inspection reports. You can find that right now at AZDHS.gov.